Thank you so much for joining us today. We're sitting with Dr. Gita Vaid, who is a board-certified psychiatrist, an extraordinary psychiatrist, as well as a psychoanalyst based out of Manhattan, and deeply immersed and involved in MAPS and the emerging psychedelic form of medicine. And I'm so excited to be speaking with Dr. Gita. I've been a big fan for a while now, and having this conversation was on my bucket list. So we'll get right to it. Thank you for being with us today.
Well, thank you for having me.
Of course, of course. I'm going to ask you an interesting question. There was a show in Britain called, I think, Desert Island. And one of the questions that they would ask a lot of the guests was, celebrities and different important people, if you were on an island, what song, if you could only choose, what song would you bring with you? And that's not what I'm going to ask you. But if you were to go to an island and there was a population there that had no medicine, no methods of treating depression, anxiety, trauma, or any other form of behavioral health, one modality, that's all you could bring, what would it be?
You're talking about a treatment medicine or
Yes.
an approach, or
Either.
I think the idea of self-inquiry, meditation and self-inquiry. Maybe that's two, but I think they're kind of captured in one. Because it's also easy, it's available, it's affordable, it's scalable.
Wow. So can you elaborate on self-inquiry a little bit?
Well, I think that to know more about who I am, what informs, what my actions and behaviors lead me to every day. We take it for granted, but we are so used to habits. We're creatures of habits. Even our thinking, our actions, our responses, oftentimes we don't stop to question them or to delve in a little bit deeper or to open up that exploration and self-discovery.
Yeah, I love that. For the longest time, and you're using very eloquent clinical language for what I always just refer to as what, not why. So often we begin our questions with why. Why is brimming and laden with judgment. It puts whoever you're asking the question to on the defense and precludes authentic, safe self-exploration. What is a different story? For example, and I just used this the other day, you have a deer who goes to the riverbed every single day and it takes the same trodden path. And the path becomes very comfortable and convenient. And then one day, a tree falls over the path, obstructing the path, and also leaving splinters of wood strewn across the path. And so now the deer comes to the path and sees the splinters and the potential danger that it can wreak on, it can inflict on its hooves. But this is the path that it knows.
Yes.
And so it can technically explore and charter new terrain, but it defaults to its normative path. And the why could be, why are you doing that, Mr. Deer or Mrs. Deer? Why are you engaging in a practice that could be inflicting self-harm? Or we can ask what happened here? And if we unpack the what, it's that it defaulted to what it was comfortable with, as opposed to having the courage to break the trend, even though it acknowledged that it was better. So the what versus why, I feel like, is so constructive, even in a non-clinical setting. You're talking to a child, you're talking to a spouse, you're talking to a colleague, you're trying to have some constructive dialogue. What is always more pragmatic and effective than the why?
I agree with you. Just opening up with a curiosity and an ability to not assume you know, even about yourself.
Right.
So you can actually discover what's a little bit behind that behavior, or where does it come from, or what if you stopped making that turn to the left instead of the habit of doing so.
That's right. And I think another very important contribution of self-inquiry is the ability to break the external influence that is so embedded and enwrapped in our decision-making and our consciousness that we actually take it for granted and we think it's coming from ourselves. So I always see, for example, feelings as having really three separate categories, three categories of emotions. You have natural instincts, And then you have environmental feelings, environmental emotions, which is the result of the culture, the community, the family, the ethnicity, the religion. And then you have the hardest to stimulate, which is the intelligent emotions, the emotions that come from the byproduct of meditation, of thoughtful exploration, and coming to a certain conclusion, and then allowing it to resonate emotionally. But the middle category, environmental, we don't recognize or pay enough attention to how much of what we feel is not really us, but is society and culture sneaking into our thoughts and our feelings, and us not taking the moment, taking the time to distinguish what is it, and asking, what do I really want?
Yes.
Yeah. Well, no, and just asking, what do I really want, sometimes yields very interesting answers.
Absolutely. Well, you're really talking about all these different layers that one can become skillful at identifying and perhaps opening up an inquiry to get beyond and a little bit beyond, or even open up different streams that you're describing to have awareness about all of these contributing factors.
Yes.
I love it.
Just to go back to the island question, if you could take one medication, what would it be?
One medication.
And I'm including psychedelics and traditional medication. But only one.
Only one. Okay. Probably just because I think it's the easiest to navigate for people. So you don't need so much lead time, or probably MDMA.
Oh, wow. And for everybody who's listening, you're actually a MAPS certified therapist.
Yes, that's correct.
MAPS is the leading movement to bring MDMA to a state of FDA approval, and we're hoping for some exciting news.
And let me say 2 reasons why. Not because I think it's an effective way to treat trauma only, which of course it has been shown to have breakthrough status, which is unprecedented in the treatment of PTSD, because I'm assuming on this island there's not necessarily a high incidence of PTSD, but largely because all psychedelics, I think, really allow people to learn and discover what it's like to feel safe and to be in a state of safety. And maybe the way you employ them can be different, and there's a different kind of atmosphere with each. MDMA, I think, is one of the easiest ones to know how to navigate, because it opens you into a heart-open, safe space. And I think...
Reduces the amygdala?
It does. It works. That's just right. Kind of reduces our fear centers. So we drop into a state of just safety in the body and in the mind and in the emotionals. And so people have a chance to either process unprocessed trauma or even open up into what it's like to be them in a state of safety. And it's not as psychedelic or mind-altering, so it's easier perhaps to...
As what? As, let's say, psilocybin?
As LSD or psilocybin or
ayahuasca.
Some of these other ayahuasca. So it doesn't necessarily open up those channels for people where you have these heavy visuals or information. So it's less trippy, but it's easier to navigate because it's pretty, it's pretty much like being in a very safe, cozy embrace.
That's beautiful.
And the reason why I think it's important is, as I said, not only for processing trauma, but once where it's safe, a lot of the energy that we didn't even realize was tied into keeping ourselves safe gets to be, in some ways, dismantled. And all that energy, which was tapped into that system or those systems, gets liberated for creation and imagination.
Wow.
It's a way of reclaiming yourself, really.
Wow. So just a couple of fascinating answer. It's intriguing. I would love to get, and I know it's a complicated thing to do, a 1-minute sort of breakdown of the difference between MDMA and ketamine. Both are chemical compounds. Both are composites produced at a lab. They're not natural plants. Right. And both are going to change the world of behavioral health. So maybe just a 1 or 2 minute understanding of what makes them different and what is more effective for what. These are
not naturally occurring chemicals, as you mentioned, but our brains do have receptors to receive these molecules. And one works on a serotonin and dopamine system, and that's MDMA. It causes a huge release of all these neurotransmitters that we might be familiar with from psychiatry. And MDMA is a novel antidepressant. It's been around forever for anesthesia and pain, but more recently it's come into vogue in psychiatry for its rapid action of antidepressant effects. And it works on the glutamate system, so it works in a pathway that hasn't really been very present in our minds in psychiatry. But for the purposes of today's conversation, aside from having pharmacological treatments, I think the most radical aspect of both is that they can, in a way, get us out of our thought loops. Because normally, people who are depressed or people who come into treatment for behavioral problems are dealing with negative thinking patterns, rumination, the way they feel about themselves, identity loops that they're stuck in. Those can actually be, in some ways, broken, and people can have a time out from those patterns to really go a little bit deeper in their inquiry of who they are, and even a re-inquiry or renegotiation of who they might be. Because sometimes we join the dots on our early life in a very particular way, and we stick with them. And this is a way of almost upgrading our operating system. And in addition to that, to actually learn how to feel safe, and in that field of safety, as I said, in a very automatic way, not therapist-driven, but the subject-driven themselves. They get to really process whatever is in their psyche or in their bodies that they may or may not know are there, but it comes out in a way where they can really get free of what's stuck in them, or find novel solutions to work it out. It's a very beautiful process.
That's amazing, because unlike SSRIs and unlike traditional pharmacological intervention, which requires a maintenance regimen,
Yes.
here, the way I almost see it, it's like you're in a dark room all your life, and every time you get up, you bump into a piece of furniture, so you begin to think that the entire room is not, you can't navigate it, and you can't have mobility and freedom of passage, and then the lights go on, and even if it's for 2 minutes, and you see the layout of where the desk is and where the shelves are and what you've been tripping over, and you also see the space that you can navigate around it, even if the lights go back off, you know how to get your way around.
Yes.
And that's so important, because that is one of the most breathtaking contributions of the psychedelic intervention, is that it doesn't make you feel less of yourself, which is a common symptom of SSRIs. People feel weak, lethargic, or they don't feel alive. And it's sort of a life sentence. Whereas here, it's not, hopefully not the case. It's something that occurs over a few sessions, and you're able to have that insight into how not to fall back into those loops, into those patterns of fear, of insecurity, of depression. Is that accurate?
It's completely accurate. I would say it actually allows you to get to the underpinnings of your problems. So rather than just treating the symptoms of why are you sad, it more gets into how do you process what's bothering you to have more of yourself back, to get to the underpinnings, to solve those issues. And sometimes it's not even so much about having to work out a problem, but sometimes it's more about growing ourselves, to hold more of ourselves, hold difficult feelings, let go of certain feelings or experiences we've had in our past. And the process is so different. Sometimes it's also providing what wasn't provided. So there's a way we can actually, on a pharmacological level, these drugs create a hyperplastic and hyperplastic mind and brain state. So our brain and mind are primed for transformation. And also some of the critical windows of our early development get opened up. So we can have new information come in to corrective experiences, and being able to take in what wasn't provided for us. Even something as simple as care and attention, being seen, being listened to, being validated. Some of these things which might be a little bit fraught from early life, which build one's self-esteem, self-identity, feelings of worthiness. Some of these things can actually get to be re-experienced and corrected for. It's quite stunning.
Very, very interesting. So I'm going to ask a little bit of a nuanced question.
Please.
So there's hardware and there's software. TMS, for example, targets the hardware of the brain.
Yes.
The therapy, talk therapy is all about the software.
Right.
Now, we're all talking about the golden standard of psychedelic treatment, which is with MAPS protocol, with therapy. But my
Yes.
question is a little bit of the following. When you have an intervention of MDMA or ketamine, so number one, let's just take MDMA for example, you're entering into a state where you feel safer because of what the MDMA is doing to the brain, lowering the amygdala, lowering the fear center. And so now you're primed and positioned to be able to obtain levels of self-awareness and insight that normally your defense mechanisms wouldn't allow you to probe and ask those really challenging, potentially existentially debilitating questions, but you can ask those questions now because you're in a safe space, an emotional, cozy environment.
Yes.
So now that insight is something you can walk away. That's the goodie bag that you can take home.
Right.
So that's a little bit on the softer side. But what about the hardware? Does it actually also create a physiological change to the brain, which allows for that insight to be implemented and to upend and change decades of toxic and negative thought patterns and behavioral patterns because something physiologically shifted through the MDMA intervention?
Yes, absolutely. There are personality changes that are enduring post the session. You see an enhanced rate of connectedness. It's more like the more we can connect with ourselves, the more we can then mirror that and connect with other people. And you see that personality traits are really sustained. And you see much more openness, much more connectedness.
Even without therapy, ongoing therapy sessions?
You know, I would say the studies usually have a lot of therapy within them, and
okay.
actually some subsequent sessions. So it's not just the pharmacological effect,
Right.
It's really in the context of pretty intensive psychotherapy and support. But those behavior traits are sustained. And what's also interesting, there's an enhanced also nature relatedness and community relatedness. So it's affecting not only personal health, but also, you know, ecological health and community health, which is so necessary in the world we live in.
That's right. So it's a little bit of both.
Absolutely. I
little
think
bit of
it's really
both.
interesting because psychiatry has swung between the psychological approaches
That's
and
right.
now more recently the biological approaches, both of which have been somewhat disappointing.
Right.
And this is really an opportunity to bring both of those together.
Yes, and I think that the fact is that even though we're so complicated as human beings and we're composites of so
Yes.
many myriads of different parts and and angles and moving pieces, we are a unified organism. And you know,
Yes.
not appreciating that in a treatment model, in a treatment plan, and only isolating one area, one symptom, and focusing on that, it's just not going to be sustainable and effective. And bringing the biological, and everybody's talking about that right now, the biological and the psychological and the spiritual all together is really
Yes.
the key, is really the only way. Who would be a candidate for ketamine as opposed to MDMA? Because just for those who don't know, ketamine is such a softer experience. Time-wise, it's 2 hours. You know, MDMA, what is it, 8 hours?
MDMA is 3 to 6 hours.
3 to 6,
So
so
it's
maybe
quite,
with
and sometimes we give a booster, which can extend the session.
Yeah.
I work a lot with ketamine in my office, and I teach at the Ketamine Training Center.
Yeah.
And ketamine is a very versatile medicine for all the reasons you mentioned. It's really well tolerated on the mind and body. It's short acting. Oftentimes you don't have to come off antidepressants if you're already taking them for symptoms, because sometimes it's hard to come off them when they've been partially helpful. So it has a lot of advantages. I would say it really depends on how it's employed. You know, I think that ketamine can be a wonderful tool for ketamine-assisted psychotherapy, where you're using ketamine as a psychedelic to open up a healing process. It just takes a little bit of learning how to navigate and dose effectively, but it's a beautiful medicine. In some ways, I like to use the example of, you know, each one of us, we're the same. The person does not change. And you can learn about yourself through traveling the world and going to Italy or going to Europe or going to India. And you can look at a person and know something about their makeup to make an assessment of you would be better off going to Europe than going to India. India might be too stressful for you. And so you can really tailor the medicine for the individual. I would say people who have a lot of, who I think, oftentimes people who have a lot of issues with control and letting go and a fear of being in a long experience, sometimes ketamine has the advantage to know it's going to be short-lived, and even at low doses might even last only about 20 minutes, 20 to 40 minutes. And just learning how to navigate the experience can be really nice. I would say, and so much of this depends on the dose, because ketamine is very different at high doses than lower doses.
Yes.
But at low doses, it almost allows for a meditation, which can be a very, very gentle experience. So it can be a very nice way to start someone into a process. It is a little bit of an internal experience. So you do oftentimes have your eyes closed and you're going inwards. And for people who can't tolerate that, who maybe have had so much anxiety about abandonment and loss, sometimes that requires a lot of early preparation, or perhaps something like MDMA, which can be more outward related, might be a better choice. So you have to look at the individual and the type of trauma they have and what they're holding.
Right. But broad strokes, would you say one is more effective as far as diagnoses are concerned, whether it's depression, anxiety, trauma? Would you say, just on a very generalized basis, that one is more suited for a certain diagnosis?
I think there's obviously a cross-diagnosis, and a trans-diagnostic is what we call. So I think they all get to the underpinnings. But generally speaking, I would say there is a lot of data, and I think this is definitely true, that ketamine is really good for depression and suicidality. It can really break those thought loops right away and give you a little bit of a lift the day after. And so it's a really good treatment that I think of first line, really, compared to other psychedelics for major depression and treatment-resistant depression, or with a lot of depressive underpinnings. And MDMA, I think, can be good for depression, but really it's very good for processing trauma. And you can have a depression a little bit afterwards because it causes serotonin depletion. So you can actually have a little bit of blues or a little bit of a letdown after an MDMA session, which is not terrible if you know to expect it, but if you already are struggling with depression, that could be a little bit of a disappointment or an exacerbation, so you have to be a little bit careful about that. So I would say by and large those are the two big camps, but the devil is in the details, and we're all so unique.
Which one gets rid of ego in a more aggressive way?
Well,
and I'll tell you afterwards, after your answer, why I'm asking that question.
When you say get rid of
So
ego,
I'll jump straight to
please
it.
tell me.
I feel like, because I come across couples who are struggling.
Yes.
And a lot of them really are cut out for each other. They really are the perfect match.
Yes.
There's just so much ego, and small things become big things, all because of narratives and a rigidity for confirmation bias, to see all subsequent interactions within the prism of that narrative that they created. And the inability to leave that narrative is very often ego-driven.
Yes.
And so I feel so strongly that one of these psychedelics is going to change the game of marriage counseling.
I think they all could in their own way, but the one that has a lot more, I think, immediacy might be MDMA. They've done some studies looking at it for spouses of PTSD, because of course PTSD wreaks havoc in relationship too. But I think it makes sense, because you can have your eyes open, you can be in conversation with each other, you're in a very heart-open space. So in that space, it's very easy to remember why you chose the other person, and get beyond some of the drivers that we all tend to get locked up in everyday life.
That's right.
That being said, I think ketamine can be another pathway in. I have done very, very beautiful ketamine sessions where people can actually have sessions lying side by side and dropping into themselves, and in a way, a different way of experiencing themselves and being close by to their partner. And when you come out of the session, a really open field for frank discussion and intimacy.
After the ketamine.
Yes.
You've paved the path for very
it's a little
healing
bit,
and therapeutic.
Absolutely. I mean, I think sometimes you can do low doses while you're talking during it, but really I think what's nice is to drop out and connect deeply with yourself. And I don't mean necessarily flying off to another realm, even to drop into remembering who are you when you're safe, because we tend to get triggered in couples situations and we don't feel safe, and we're trying to stand our ground to have our to defend really ourselves and our wounds. And if you can drop out of that and connect with yourself and feel safe and recover from that, it's a very different climate from which to see the other person and connect with the other person and perhaps see what they're saying from their point of view and come together.
Beautiful and very profound, and I hope it actually begins to take off.
Absolutely.
Because it's one of those things that people can spend so much time in marriage counseling and make things worse.
I see
and
that a lot.
Spin more tales and get more frustrated. Dr. Willa Hall, I don't know if you know who she is.
I do, yes.
You do. So I actually interviewed her a couple years ago about her work at MAPS.
Yes.
And it became clear to me how expensive this would be if it hits the market. If MAPS protocol, I'm not referring to the compound, and I don't mean expensive in a bad way. It's because there's 2 licensed therapists with you for 3 to 6 hours. Now,
Yes.
that is very prohibitive at a cost level.
Absolutely.
And ketamine is a lot cheaper. I don't mean the compound. I mean even the monitoring, the supervision, and they're just very different, as you're describing.
Yes.
Do you have any ideas of how we can make this amazing MDMA MAPS protocol somewhat more affordable and accessible?
Well, I think you get into different pros and cons. So we do need to make these medicines more available and accessible. And it's really a lot of time and energy to have 3 to 6 hours with one patient, even if there's one therapist versus 2 therapists. So I do think even when these medicines come available, I'm not sure that they're better off doing a series of ketamine sessions with me rather than just to have the process keeping on unfolding and growing, rather than one shot at MDMA. So I think that, it's true. That's why I'm a big fan of ketamine. It's a beautiful medicine. And I think it's available right now.
That's right.
And so people can access it right away. It's still not completely affordable and available. Ketamine itself is, but the therapist's time is expensive.
Correct.
Although a lot of people, because I do 3-hour sessions, initially it felt like it was very costly, but it shifted my way of working with someone instead of weekly psychotherapy to maybe once a month, where actually they're seeing me for 3 hours a month rather than 4 hours. And I do bill by the hour, so it's overall less expensive, not more expensive. So there's different ways of navigating and working with these medicines, but I think we need to have different systems available, and we do need to have insurance coverage at some point. Of interest, though, is there's a lot of interest in group psychotherapy. So I think if you have 1 or 2 therapists in a small group, that might make it more affordable. And then you also get the benefit of the group itself, which can be very, very valuable in healing.
Yes, I think the group therapy is very powerful for optimization, for deeper insight, and for becoming a better person. I think it's hard to get to the bottom and the underpinning of your specific story, of your specific narrative in a group setting, because if you do begin to share too much, it's not fair to the group either, even if you're comfortable sharing all that. And so there's a room for both,
There is, but I think with MDMA, because the sessions are long, there might be room for introspection, going inwards, as well as being out and in conversations. So there might be a way to blend that together. And I know there's a really nice study that is going to be done. There's already approval for, I think, 400 subjects, not all in one go, in one large group, but in smaller groups with therapists in Israel, which I think will give us a lot of data. MDMA, and I think that'll allow us to have a lot of information. Of course, there's a lot of need for treatment.
Because generally their behavioral health scene is more primitive than here in America. So I'm surprised that they're doing something cutting edge like that.
Well, I think there's a lot of big need
there's a huge need and a growing
treatment.
Need for treatment right now.
So fortunately, there's a lot of initiatives to help address the trauma and suffering that is happening over there.
Absolutely. And then 2 more quick things that come to mind.
Yes.
Peak performance, I'm not going to say recreational, but peak performance, there are a lot of folks out there who don't have a diagnosis. They've never been to a psychiatrist.
Yes.
They might not have even been to a therapist. They're intrigued. They see friends who come back, and everybody who's gone through a psychedelic experience and had a positive one becomes a self-appointed missionary and wants to share this with the world.
It does seem to be a trend.
Wants to share their experience with the world and how this is going to change your life.
Right.
And so they hear about this a lot. And they do feel a little bit of stagnation in their life, whether it's corporate burnout or a non-aggressive midlife crisis. What's your take about psychedelic use for somebody who just wants more out of life and doesn't have what we might call medical necessity?
Well, I think what you're really tapping into is we all have different levels of trauma that we're dealing with. I think it doesn't mean to say that you have to be, rendered incapacitated to qualify for trauma. There's trauma with a lowercase t, but we all have different levels of trauma, and I think there is a real yearning that a lot of us hold to really break out of that and to actually meet ourselves and to, start a healing journey. And where you start the healing journey might be from severe symptoms and pain and suffering, or might be more ambiguous, but still a yearning for something more. And I think the healing journey is really a pathway towards meeting oneself and blossoming into one's authenticity. And I think we were talking earlier on how I think the human condition is such that we do get stuck in these patterns, and we do not really have access to our full creative potential. And I like to use the example of dreams, because I am a psychoanalyst and I do recognize their value. But I think all cultures in history have recognized there's something magical and very important about our dream life, because you have access to this real deeper knowledge. But that's us. Sometimes we don't recognize that's a part of our capacity that we are not utilizing in everyday life. And I think these medicines really open up these pathways to tap into our higher intelligence, our truth, wisdom from, that we're carrying within us, and to really open up those pathways to recover ourselves and perhaps find who we really are on a deeper level and what is our purpose. Why are we here? Which I think is sometimes lost and disconnects us from ourselves, and really gets to these underpinnings of why are we struggling? What could we be doing here that could really be rewarding to give us purpose and meaning?
Very interesting. So in a certain sense, we can all benefit from a psychedelic experience in a safe setting.
I would say we can all benefit from this inquiry.
Whether
or not you need to take psychedelics is a separate issue.
Yes.
I think the idea of trying to go deeper to meet ourselves, I don't think psychedelics is the only way to do it. I think there are many people who can do this without psychedelics, through introspection, through different practices of self-inquiry. Meditation is one. But I think people have their own ways of what is meditation, spiritual paths. And I do think that that's a really important inquiry, which I would endorse people should undertake. Psychedelics is just one tool.
Right.
It's a little bit of a lazy man's tool.
Interesting.
But I think it's a very helpful one.
Yeah.
And I think some people don't have too much trauma to actually really be able to break out of it. So this gets into the, who's a good subject. And psychedelics also have some risks with them too. So there might be people who have medical conditions or psychiatric conditions which would make them ineligible, or would be a little bit more dangerous for them to use. So you have to be careful.
Yeah.
But that doesn't mean to say that they couldn't find other paths towards accessing non-ordinary states, even pranayama, breath work.
Right.
There's all sorts of approaches to hack our nervous systems to access more of ourselves. Psychedelic is just one way.
Very interesting. And the idea of this being a lazy person's approach. I mean, that's obviously, in that context, you certainly you see with certain folks who they don't become addicted to psychedelics, but they do have an unhealthy sort of relationship and dependency on using this lazy path to access.
Well,
this
there are no
deeper
shortcuts as well.
That's right.
And when I say lazy, I mean that with respect. I think meditators can get there from sitting for hours a day. And in this day and age, some of us don't have the luxury of being able to dedicate several hours a day to our daily self-care practice. We have a lot of demands on our time and energy.
Yeah. And then two final questions.
Please.
What bothers you the most about the current healthcare scene today? Behavioral health, the methods of treatment, protocols, legislation. What really disturbs you the most?
I think what disturbs me the most is that it's really very generic. They're looking at the generic solutions to pretty much say how one should treat depression. It's not tailored to the individual. And we're all so unique, and our stories are so individual. To look at each case, to just have a prescription for the individual before I've even laid eyes on them, is very, very annoying to me, because when you get the whole picture, I used to work at an anxiety and depression clinic very early in my career. And it was just really a good lesson because I could see how everyone wound up with depression and anxiety. But each story was so unique, so individual, and the way you want to treat them has to be unique. Otherwise, I think you're really shortchanging them. It just winds up being, it's a little bit like, I think, taking care of children. I think that each child requires their individual attention. If you try and just give every child the same treatment, it's a little bit dehumanizing, to say the least.
That's right. That's right. And that is disturbing. I mean, I come across that all the time.
Yes.
Whether it's in substance use disorder, whether it's in depression, anxiety, we just look at symptoms and we treat symptoms. Very seldom is there like an investigative, like Sherlock Holmes level of scrutiny as to how did you come to these symptoms.
And I think it's really important not only to get the right treatment path, but then also to really empower the individual you're with to realize, wow, someone is interested in me, they're asking these questions. And I think implicitly, why am I not asking those questions myself and opening up this road of discovery?
That's right. Last but not least, currently for ketamine, it's typically described as the preferred method to treat treatment-resistant depression.
Yes.
So those who have failed with traditional treatment, antidepressants, SSRIs, in your view, is that the right way, or should we stop seeing ketamine and then, pretty soon MDMA as last resorts for those who are treatment-resistant and start looking them as, potentially a first resort as well? Not for everybody, but should we? I
think that they're a very different way of treating depression, and so I would like it not just to be last resort, end of the road. Largely because I practice ketamine-assisted psychotherapy, which is different just using ketamine, which is a wonderful tool, which oftentimes I will refer people to go to a clinic to just get rapid-acting antidepressant coverage when they have failed other treatments, which is a beautiful indication. But I think the difference is it allows an individual, when you're doing the therapy, not just to treat the symptoms, but to actually delve behind the scenes to figure out what is bothering them, where does it come from. And I can give you an example just to illustrate the beauty of it. When I was working with a young woman who had tremendous PTSD, had done a lot of work to really address the problem. I wouldn't say cure the problem, but deal with it better. And this was a young woman who had 2 rape episodes in her life, unfortunately, and was in an environment where she was getting triggered constantly because it was the scene of where this event had occurred. When she went into her session, she actually saw, during the ketamine session, a whole beautiful, intricate tapestry with all sorts of elegant stitching and threads and yarns, and she saw that as a representation of her life and who she was. And she also saw a stain on this tapestry, which she recognized was these terrible, abusive events that had happened to her. But during the session, actually was very joyful. She saw the fallacy in how she had recognized the stain to be her center of gravity and how it dominated her life and had hooked her, when in fact it was just a stain on one section of her fabric. And then there was all this richness, which was her. And in that moment, she herself managed to reorient herself to a fuller sense of who she is, which was not so hijacked by these terrible events, which is really what trauma does. But it was the most beautiful piece of work in rapid speed for her to use her creativity, her intelligence, her imagination to really find herself through this trauma and towards recovery in the most elegant way.
Wow. I love that. And, the imagery of the tapestry, and then also talking about dreams and their significance, it just begs the question, and I get this a lot with people who have come from an ayahuasca trip or another psychedelic trip, and they see a vision, and then they struggle with its significance, and even when they are able to unpack and extrapolate a message that has relevance and personalized significance for them, a lot of times they'll ask, but is this really true? Meaning, yes. I may have seen it, but what's the objective sort of value proposition here? And how do you answer that?
Well, if I'm going to answer it in an indirect way. I'm going to say something about memory in general. Memory is incredibly unreliable. I was talking to my colleague and friend, Dr. Bessel van der Kolk, who's a trauma expert, and we were talking about really how memory itself, by its nature, is very unreliable. You see this at maybe family events, and the stories get more and more elaborate about the past, and we start exaggerating bits and pieces. And by their nature, they're unreliable, and how we weave them together keeps changing. That's just the nature of memory. And trauma actually prevents that from happening. We keep on re-experiencing the painful truth. Unfortunately, it doesn't become unreliable. We keep on having the bad event be re-experienced, re-triggered, and re-experienced over and over again. And in a way, we want to process the memory during the treatment so it can just be like ordinary memory and go back to being unreliable and woven back into the tapestry of everyday experience. So in terms of did it happen or did it not happen, I think we're talking about subjective experience and how we can shape our world. And there's something really beautiful about what happened, and the experience definitely happened for sure for that individual. Whether or not happened really, or it's their imagination, or it's different realms, I think we can leave that aside. I think it gets into, this is your subjective experience, and to me it's that whole landscape between dream life and waking life and all the space in between that we're constantly weaving in and out of. Daydream, imagination, play, and actually to have that expansion, I think, is growth in and of itself, because we're constantly shaping our reality. No two people have the same reality, even if they're having the same experience. Wow. So to be able to live in that richness allows for actually an expansion of our daily experience, but also allows for us to really use these experiences usefully, because our inner world is being reoriented, reshaped. If we look at what really the underpinnings of what organizes, the lenses that organizes our experience, usually they're formed from early life and from what Freud calls primary process thinking, which is symbolic thinking, which is really creative in the poetry of everyday life.
That's right.
This gets us into these layers in these experiences, and so it's a way of almost swimming in the river of our inner worlds and the inner tapestry of our inner worlds to really make changes at that level. And I trust we make the changes at whatever level we need to. Our beings know, our intelligence guides us.
That's so profound. In other words, what you're saying is, it makes no difference. Because there is objective value in my subjective perception.
Absolutely.
And that shapes and forms my subjective experience. And that is objectively trackable. You could see how that changes me, regardless of whether the mystical vision or the tapestry of what I was seeing occurred in someone else's world or in the outside world. It happened for me.
If you think about it, it's all we have.
That's right.
It's actually the only thing we can measure is our subjective experience.
That's right.
The rest of it is the speculation.
That's right. That's right. I'm reminded, and I'll conclude with this, a beautiful quote from Bernard Shaw.
Please.
Bobby Kennedy later plagiarized it. It was, some people see things that are and ask why. I dream of things that never were and ask why not.
Beautiful.
Yeah.
Thank you.
Thank you.
It's been a pleasure.
It's been a real pleasure.